Regarding where we are with the monkeypox outbreak, on the 23rd of July 2022, the World Health Organization DG Dr. Tedros declared the current monkeypox outbreak as a public health emergency of international concern. Now, although monkeypox is less contagious than the smallpox and COVID-19, and all of us, smallpox has been eradicated in South Africa many years, almost 40 years ago, and many parts of the world. We're all familiar with the COVID pandemic, but the monkeypox causes less severe illness. The current rising numbers of positive cases has become a cause of concern, and therefore we cannot ignore it. I'm saying this because on Wednesday this week, on the 17th of August, we got a report from the NICD, NHLS, that we've had our fifth, number 5, positive case of monkeypox, which was a 28-year-old male from Johannesburg, Gauteng, with a travel history of Europe, Netherlands, and also it looks like it might have touched in Spain as well. The case was confirmed through a private laboratory, and samples were also sent to the NICD for sequencing. Now, this means that, as I said, we have recorded 5 positive cases between June 22 to the 17th of August, just 2 days ago. But there is no link at this stage, as the link has not been established with all these cases. But the team is still trying to check whether the last 2, the number 4 and 5, might have a link, because both had traveled to Europe, and it looks like to Spain, amongst other countries. We know that Spain has already recorded more than 5,000 positive cases and 2 deaths. Now, case 1 was recorded on the 22nd of June from a 30-year-old male residing in Johannesburg in the Gauteng province with no recent travel history, but who had presented with symptoms of monkeypox, and when tested, it was confirmed that it was monkeypox. The second case was recorded on the 28th of June from a 32-year-old male residing in the Western Cape province. Again, here, there was no recent travel history, but presented with symptoms, and when the laboratory test was done, it was confirmed. Now, in as far as the third case is concerned, was recorded on the 10th of July from a 42-year-old male tourist from Switzerland visiting Limpopo province, also displaying the symptoms, and when the test was done, he was found to be positive. The tourist has recovered and has subsequently left for his home country. Now, the fourth case was recorded on the 14th of August from a 28-year-old male in the Western Cape, who I've already referred to the similarity with the fifth case, who had recently traveled to Spain and presented with symptoms suggestive of monkeypox. The test confirmed positivity. Now, I need to mention that that's far. I've already mentioned about the tourist who has already returned back. All the 3 other cases have been mild and recovered, and also the fifth one, as far as we are aware at this stage, is very mild symptoms, but confirmed by laboratory. So, the World Health Organization has not recommended any travel restrictions, but it is important that people who are traveling should exercise maximum caution. Now, in terms of there's a lot of questions just in terms of how the monkeypox is transmitted. It does involve person-to-person transmission, close contact, or infected materials contaminated by an infected person. Although the data just shows that most of the cases have been some form of sexual contact, sexual partners, but it can transmit to anybody as a result of close contact with somebody who has been infected with the monkeypox virus. Now, in terms of the vaccination, there is currently no specific vaccine for monkeypox in our country. There are vaccines which have been confirmed in the world. There are 3 main vaccines worldwide for the prevention of monkeypox. Quite some complicated scientific names, but there are 3 of them. One branded as Imavac in Europe, and the third one is called LC16M8. Now, so these vaccines are available in the world, but at this stage, we don't have any of this registered in South Africa. In terms of where we are currently with the COVID pandemic, I've mentioned in the beginning that we lifted all restrictions just around 2 months ago. I think 2 days from now will be full 2 months. Now, since we lifted the restrictions because infection numbers were very low, high levels of population immunity, and sustained decoupling of the infection rates, even when there was a small fifth wave, the decoupling between infection rates and severe illness continued, with very few people being admitted to hospital and even fewer needing ICU treatment. Now, since the lifting of the restrictions, the rate of testing, in other words, people presenting with symptoms for needing tests, cases, hospitalization, and also deaths have all continued to decline. Now, we believe this is an indication that we acted in the right public interest, because up to 2 months now, we have not seen any flare-up of COVID-19. Now, because currently the infection rates, as I said, it's at a low rate, and we're shifting to a more endemic pattern, where we have also shifted our daily reporting to now weekly reporting, as we do with other respiratory illnesses such as influenza. In addition, we have stopped reporting on COVID-19 antigen testing because of poor data quality from antigen testing. This allows us more robust estimation of trends rather than when small daily numbers are followed, which are affected by small fluctuations. So on the national level, I want to assure South Africans that we are continuing to monitor working with our National Institute of Communicable Diseases. The NSID is still continue on the surveillance and gives us surveillance reports. The ongoing monitoring of genomic data is also managed by our network of genomic surveillance, and this includes monitoring of the emergence of variants and lineages from tested patients and wastewater. Now, in the last few months, there have been some identification of some different variants, but what is comforting is that none of this have proven to be much of significance, and the pattern has not changed.